Over the next 30 minutes, we hope to take you inside everything that's exciting that's happening at the Ottawa Hospital. So I'm going to bounce a little bit between Dr. Auer and Cameron, and hopefully we'll cover many topics that you will find interesting and informative about the Ottawa Hospital. So Cam, I'm going to start with you, kick it off. And those of us, I think we all recognize that for many years, hospitals have been siloed, whether that's from budgeting, whether that's delivering programs across the community. And I think you're trying to change that with the hospital strategic plan around reshaping healthcare. So maybe you can speak about your goal to bring more alignment within the city.
So thanks, Tim. I think I'm going to take you back a few years. So if you go back pre-pandemic, we have always been a center very focused on acute care. And if you look at the Ottawa Hospital, probably for the last 5 to 7 years, we do about 60% of all adult health care in this entire region, which would be from Barry's Bay to Hawkesbury to Cornwall, all of Western Quebec and all of Nunavut. But as or more importantly, we do 100% of everything that is really complex in nature. So when you think about, unfortunately, complex cancer, neurosurgery, trauma, vascular surgery, we are the only center that provides it for the entire population. And so pre-pandemic, our focus has always been around making sure we manage those tertiary, we call them tertiary or the real complex services in healthcare. We will always do that going forward. But what shifted with us during the pandemic was about 2 years in, what we really started to realize was that we need to be more focused not on an episode of care when people are at their most vulnerable state of illness, but we got to build capacity and improve the health within this community. And if you look globally, and forget funding models for a second, but you look at every other major center across the globe, none of those centers anymore only focus on hospital care. They focus on building capacity and services for people before they get to the hospital, when they're in hospital, which we will always do, but as or more importantly, when they leave hospital. And with a growing and an aging population that is very rapidly growing, particularly over the age of 70, very, very, very few patients that come to us for care today leave without some type of care, whether it's long-term care, whether it's primary care, whether it's home care, assisted living. And what we really saw through the pandemic was that one of the big challenges in this community, much like the rest of the province, is that we do not have enough community capacity. And so considering our infrastructure and the fact we provide huge portions of care for people, what we have started to shift is to not focus on building a hospital, but building a healthcare system. And so to that end, we're building primary care clinics. We've got 2 long-term care homes we're building. We've got 3 community surgical centers. We are spending as or much more time building infrastructure in the community to improve the health of people, not just the episode of care when they get to the hospital.
You know, people think about the Civic, the General, and Riverside. There's much more to the Ottawa Hospital and the community. Is it 19 sites that we have now across
23.
the city? 23 sites of the Ottawa Hospital with this partnership network within this region. So Cameron, you know, Jennifer spoke about it off the top, the new campus that we're building, and what you spoke about, how is the new campus kind of critical to that plan?
It's very critical. The reality is in this community is if you take the Civic campus and you take the General campus, they are the 2 hubs for the provision of probably the most advanced care that people require in this community. And so our General campus tends to be more focused around cancer care. And we make sure we are, in essence, protecting that entire resource to support cancer and other complex diseases. The Civic is the one that provides care for those that typically tend to be more emergent in nature and very acute. Your car accidents, your trauma programs, your neurosurgical programs, people with unfortunately brain diseases, whether it's ALS or strokes, et cetera, all of our neuroscience programs. The catch with it is you have to build, if you move things to the community, they tend to be lower acuity cases, but we need more of that infrastructure. What you need with the hospital is you need advanced infrastructure to be able to advance care and support research to continue changing the trajectory of how we provide care for those with most complex diseases. That's why the Civic and the General are so important. And unfortunately with the Civic, unfortunately it's 100 years old. Fortunately, we're building a new one. And so it is an absolute, not only catalyst to change how we're providing care, it's a critical piece of infrastructure for the next 100 years.
I was reminded as I was packing up my office to come here, at the hospital, our overhead paging called for trauma 1. And, that is a very serious call where our trauma team gathers at the emergency department, the trauma center, to take care of a critically ill patient. And, that is only being provided at the Ottawa Hospital. Dr. Auer, research. For me, I think research at the Ottawa Hospital is one of the best kept secrets in the city. And it's been over a year now that you've been leading the Research Institute. And I'd like if you could maybe reflect on research at the Ottawa Hospital. What do we really do well? What are we known for? And maybe even what are you most proud of?
Yeah, I think, Tim, you're absolutely right. The Ottawa Hospital is an incredibly research-intensive hospital. It's one of the top 4 in Canada and also known internationally for a number of things. And I think one of the reasons for that is that we really have a vision to be able to translate every promising discovery to patients through clinical evaluation to allow to implementation for the benefit of our patients. And what that means is what we do end-to-end research. So right from discovery all the way through to the best care for patients in our community and around the world, practice-changing research. I remember once my mentor that I've talked about a lot, Dr. John Bell, many of you know, an incredible researcher, world-renowned scientist, and I came to him with a crazy idea, and he said to me, if you can imagine it, we can make it. And I think that's because of the infrastructure and the resources that we have. But that's not enough alone. It's the people as well. And we can attract the most incredible minds to Ottawa because we have the facilities to be able to do that end-to-end research, which is so critical. I'm certainly very proud of our biomanufacturing facility. I think many people know about it. And of course, we got the largest Canadian grant to expand that facility to be able to make even more products. So we can make products for use in human patients and evaluate them through clinical trials. We've made over 20 products that have gone to patients, more than any other manufacturing facility affiliated with a hospital in Canada, in clinical trials all over the world, not just in Canada. But when we do it here, our patients are always the ones to benefit first. And many of you may remember the story of Camille Leahy, a patient from Toronto who had a life-threatening type of leukemia, who had exhausted all options for care. She was a single mom at the time. Her daughter was 12. And you can imagine, highly, highly motivated to find a therapeutic option, was able to come to Ottawa and receive our own designed in Ottawa, developed in Ottawa, manufactured in Ottawa therapy through a clinical trial. And she's now one of our strongest advocates, alive, disease-free, able to watch her daughter graduate from high school and go to university. These are the kinds of stories that really, I think, resonate with people. If you can imagine being a physician working in a hospital where you can do that, that feels fantastic, that we can offer that.
That's great. Dr. Auer, maybe you could just clarify for the audience, when you say develop products, what are the products that we're developing?
So we really specialize in biotherapeutics, which encompasses things like immunotherapies, so things like vaccines and viruses, as well as cell therapies, so where you can actually take cells out of a patient, engineer them to make them better at what they're supposed to be doing, and send them back in to the patient to be able to kill cancers, help with multiple sclerosis or other autoimmune diseases. We also have gene editing or gene engineering technologies like adeno-associated viruses, which again, we develop these therapies in the lab, but you can't give something that's developed on the benchtop to a patient, obviously. So there's a very specific way in which you have to manufacture these facilities. So again, we have one of the largest manufacturing facilities in the country that allows us to not just provide these therapies to patients, but because we have that technology, we can look at the 2.0 and the 3.0 and the 4.0 version of those technologies, which I think is what excites our researchers and our physicians to be able to say, we can offer that therapy here. It can't be offered anywhere else.
It's great examples of why living in Ottawa, having a vibrant research institute is so important. I read just last week an impact report that we're sending to Eric Sprott. 20 years ago, Eric and his late wife, Visma, made a very significant gift to create the Sprott Stem Cell Center, which is here at the Ottawa Hospital, world-renowned facility. And I'm taking great pride to report back to Eric all of the milestones, incredible milestones in the last 20 years. Cameron, maybe just jumping back to the new campus development, I know a lot of planning and effort has gone into designing this facility, with patient care and our clinical leadership in mind. What will patients and families experience when those doors open?
Designing and building hospitals, particularly academic centers like this one, there is a fair chunk of complexity to it. But when you boil it down to sort of the most simplest form of what we're trying to do, there's really four major components. The first component is building spaces that will accommodate a lot of the advances of what we see in technology and create spaces where our clinicians can continue to ensure we're providing the highest quality and technical care, which for services on that campus are absolutely critical. So there's that component. When you think about things like emerge departments and ORs and intensive care units and obstetric suites and neonatal intensive care units, what we're building is not completely different, but very, very different than what you see today. And it'll propel us forward in terms of having some of the most advanced infrastructure for the delivery of technical care. So that's one swath. The other side to this is the patient experience side, which is as or more important than what we do technically. So this is things like having 100% private rooms. And so there'll be 641 private rooms on this site. And so today, unfortunately, when you come into our hospital or most hospitals across Canada, you usually have a roommate, if not two, if not three. And so in the future, having the ability to have your own room where you combine, in essence, the technical aspects of care with a hotel type feeling where a loved one can stay and have a space to sleep. You have your own private room, your own private bathroom. It's far quieter than what you see in hospitals today. And it's got all natural light with windows. There's lots of research. Those are very important things from the point of view of not only experience, but healing. The other piece is just generally around information and systems and technology. We've moved to having all hospitals by next year on one information system, which means we have one medical record for everyone. Historically, it's very hard to get your information, but tomorrow you can get everything on your iPhone. And in your room, whether you want to see what medications, what physicians have prescribed, lots of lab results, you can get everything electronically now. And so for your family, what's really important is they could be in BC, they could be in Europe. You can have access to MyChart to see all those things for your family member, as well as the patient that's in the bed. And so the digital platform will allow communication, interaction, and access to information far better than it ever has had. And then there are things such as, I can never get away with a presentation without talking about parking for whatever reason, but it's a really important piece. There is nothing more frustrating or stressful for patients and family members where they got an appointment booked, they're trying to come in to see a physician, and they're circling trying to find parking. For the first time ever in my career in the city, we will have more than enough parking. But more importantly, we're splitting the flows so that patients, in terms of access to the site, it's very easy. Drop-offs are very easy. It's accommodating. And all those things, when you take those things, plus what we're trying to revamp food, what we're trying to do with private rooms and information systems, it's completely shift the experience. And so not only do you get great technical care, you actually have very good support structures to provide people with the right experience. And then the fourth major component is building research infrastructure. And to Rebecca's point, and Rebecca always says this, which is absolutely right, research is care. And so if we're going to continue to advance how we provide care to make the outcomes of health for people better, you have to ingrain research into everything we do. And so building a world-renowned neuroscience research center and incorporating research into all of our clinical areas allows us to combine those three things. So we're constantly advancing care, we're getting the best treatments to people, but we're creating infrastructure so their experience is really good.
And I think, as you mentioned, Cam, transport trucks will have a dedicated access points to the new site. All of the emergency vehicles, dedicated access points to the site, and then patients and families entering the facility. So I think it's a great site from that perspective. As you say, we can split. Many of our donors are receiving notices that we're providing some information, some video, updating everyone on the redevelopment project. But if you've driven by the site of the new campus now, it is a beehive of activity. Cameron mentioned the parking garage, but maybe you could give, many of you here are donors that have been supportive of the campaign. So Cameron, maybe you could give the folks an update on where the project stands today.
Yeah. So the really good news is we're well into construction and construction phases. A project of this size and magnitude, when you're building like 2.5 million square feet of space, no matter how you slice this thing, it's going to be done in phases. The catch with these projects is our team started the first submission. I might be the only one here that actually is still left that started the first submission. Our first submission for this hospital was 2004. And so it takes a very long time to progress in Canada in terms of getting a new hospital off the ground. Some of the hardest steps in the planning process are getting the approvals you need to get off the ground. But once you're into the ground, you start to make significant progress. And so the parking garage physically will be done as we head into the spring. We'll be able to park people in the spring there. Part of building the parking garage first was because we got thousands of construction workers going to be on site. And so you got to have somewhere for them to park. And so if you look at the site, that's the parking garage. But as we're doing the parking garage, the top part that's under construction is we've gotten approval to do some advanced works. So you're starting to prepare the site for the new building. And considering the amount of dirt that has to be moved, it takes a year to prepare the site to start to pour concrete. And so as we're doing the garage, as we're doing the preparation of the site, we're finalizing the actual design and construction approach. And then over the course of the next year, we will get into the main build phase, which will go over multiple phases because you're building 2.5 million square feet of space. And so over the course of, and the schedules move, supply chain is still an issue within this industry. And there's lots of challenges. But when you're under construction, you start to see the end point of moving these phases. And so over the course of the next year, we'll open those things and then we'll be right into the main build. And then as we start the main build, there'll be multiple phases of construction with structure and mechanical and electrical, and it'll phase itself over, 3, 4, 5 years. And then once we have that built at the same time, we're building the research center to open it in parallel. And then the site has the capacity to add things like the Heart Institute, lots more further research expansion. And then if we ever needed to, the whole chassis is built to allow us to go up to 1,100 beds. And so part of this is thinking about what we may need in the future, not just what we build for today.
Cameron, when we saw the visual, and you're going to save me an email, so I'll just ask this question. A donor asked me earlier, why is the parking garage at the front of the site and not at the back of the site?
That's a great question.
Maybe I shouldn't have gone off script.
There's actually a good answer to it. Let's see if I can actually provide this. So when we look at this, when you look at a site on whenever you're building a new hospital, and where we're really fortunate is there are very, very few new hospitals in urban centers that aren't building the downtown core where it's just one big concrete jungle. And so our ability to actually use green space is really, really key. It helps with getting people indoors and outdoors for treatment. It just brings a natural perspective to the provision of healthcare. But when you orient the site, one of the things you're really looking to do is make sure you've got geographical spaces that accommodate the design of the building. Designs of hospitals are, while I've given you the simplicity of sort of the major components, there is tons of complexity in terms of how patients come from the helicopter to the ORs, from the helicopter to the emerge, from ICU to the OR. And so the team maps all these pieces out and you get a configuration that you've got to fit in the land. The biggest piece that's most important is the first thing you said is hospitals, particularly places like ours, are probably the one building in any major town that has every form of possible transportation coming to it. No other center has that. So we're thinking about buses and taxis and helicopters, police, ambulances, bikes, walking, cars, all of that. And so part of when you lay out the site is making sure you're creating access for how people come by car, how they come by light rail, because light rail runs right through the campus, how they come by, where ambulances are coming and where trucks are coming. And what you want to do is not have any of those paths cross. You come to the Civic today and you come back the back road by Ruskin, you're going to cross ambulances, 18-wheelers, cars, bikes, all coming into one location. Part of the way the site is oriented is to make sure all of that is efficiently organized. And because light rail runs through the site, parking is built around light rail because people will come from light rail, they'll come right up into the station, and then they'll be able to cross in the main campus. And so all of that sort of pedestrian people circulation is what drives a lot of the way the organization's designed.
Okay, I answered it okay. So thank you. Dr. Auer, for some people, when they hear about medical research and the importance of research, I think often we think about today, right? And it's not going to benefit me. It's going to be in the future. I won't realize it. Maybe you could speak to how research, Cameron mentioned your quote, research is care. How is research impacting care? And what are some of the impacts on everyday people living in Ottawa and having such a successful research institute in our community?
Yeah, it's a really good point. And I think the understanding about research, we come by that honestly. It comes from our historical perspective. And as a cancer surgeon and researcher, I'll just kind of use an example from cancer. So if we think about chemotherapy, which is the backbone of many cancer treatments, has been for, 3/4 of a century. The origins of chemotherapy, who we call the father of chemotherapy, was a gentleman by the name of Dusty or Cornelius Rhodes. And he actually hailed from National Defense Chemical Warfare Division, which he led. And the first chemotherapy that was tried is nitrogen mustard. And they thought, well, it can kill soldiers. So if we use a little less, maybe it can kill the cancer. So you can imagine at that time, research and care were not integrated because you're giving very toxic substances. We don't know how they work. And we're trying to see if they're going to change outcomes for patients. Fast forward, 3/4 of a century, we went into a very deep dive into cellular and molecular biology. And that is not anything like the therapeutics that we are bringing forward today. Today, we'll say your cancer has a very specific genetic mutation. So the DNA in your cancer cell is different than the normal cell because of this particular gene. And we have this small molecule that we've specifically designed in the lab to target that gene. And we want to know if it works. So, and I'm not talking a dozen of those. I'm talking about thousands and 10,000s of them currently in the pipeline and exploding in terms of our technology. So when you're on a clinical trial, when you're trying a new therapy, it's a very different proposition today than it was historically. That's not to say that it's not important to, have due diligence to make sure these molecules are safe. But really research is care because sometimes research is the most cutting edge therapy available. And many patients on very early clinical trials might actually have completely transformational outcomes. People like Camille Leahy. And so I think that we have to have a different understanding of how research is integrated into care. And, if you look at some of the biggest hospitals across North America, Europe, we all have the same quality of specialists. Surgeons are just as good. Radiation machines are just as good. OR tables are just as good. Robots are just as good. We have all the infrastructure. But what sets them apart and what sets us apart is the research. People don't go to those centers for better surgeons or better instruments. They go because there's a research opportunity. And that defines tomorrow's care. But providing it today for patients in your community can define that patient's care today. And I think that's a really important thing to remember.
And I think we have 11,000 patients at the Ottawa Hospital on clinical trials today, right? It's the hope and promise of a clinical trial for that individual, for that family. Cameron, Dr. Auer has spoken about research, but innovation, and both of you have witnessed significant innovation in healthcare delivery over the past number of years, exploding now. But as you look at technology, innovation, how we're now partnering with industry, we're living AI now, we're modeling some AI technology at the Ottawa Hospital. maybe you could talk about how important innovation is to the Ottawa Hospital and this notion of partnership with industry.
Yeah, so innovation it's exploded over the last 5 to 7 years, but healthcare, particularly in academic centers, innovation has been part of a culture for years. And so if you look back 25 years ago of the way we did surgery then and the way we do surgery now, innovation has driven a lot of that, whether it's technology, whether it's digital platforms. It completely changes the value of how you provide healthcare. First and foremost is improving quality, but it typically drops costs, which is a major consideration, particularly in healthcare and public sector environments at the moment. What we're starting to do is we are seeing more and more innovations that are coming up that are completely changing the value proposition of how we provide care. And so I'll give you a good example, and we just rolled this out in September. There are a lot of patients that come to us that'll stay 1 to 3 days. They are acutely ill. They typically require support, and I'll use a department like medicine. Lots of medications, lots of management. They need physicians' oversight. Historically, we've always admitted them for 1 to 3 days, and then we figure out how to discharge them. What we started in the month of September is because of innovation, digital platforms, wearable devices, we're sending them right home to be cared for. They don't even need to leave their home. And so what that allows is, instead of spending, a period of time in the emerge and getting admitted with 4 patients in a room, most patients would prefer to be in their own bedroom. You can provide the same care for that population without leaving their home because of innovation. What we're trying to do now is advance that further with innovation. And our belief is that over the course of the next 3-4 years, and we started with only 5 patients in September to get this off the ground, we think we can grow to probably 200 patients in the home environment. You'll never be able to do that with innovation. You look at surgical cases. When I started with certain surgeries, and I'm not a surgeon, but having worked with surgeons for years, we did admit patients and do surgeries where they'd be admitted for 3, 4, 5 days. Those same types of patient illnesses with different surgical techniques and innovation, a lot of them are outpatient now. They come in and go home the same day of surgery. Every single program we run, whether it's OB, obstetrics, mental health, medicine, surgery, emergency medicine, innovation is a major driver of how you change the value proposition of what you do for healthcare. You couple that with research, what you completely do is change the trajectory of how we provide care. And so that is why it's always been there within healthcare. But I think with the explosion around the digital evolution, artificial intelligence, it has become very prominent in terms of how we're thinking about how we change care.
Excellent. Dr. Auer, maybe we'll talk about a great subject, funding of research. And funding of research in Canada is an absolute challenge. We know. Maybe you could share with the audience, how is research funded? And then the flip side of that is, why is community support and the foundation support so critical to the Research Institute?
Yeah, so research is funded by a number of different means in Canada. Probably the most important would be government funding through our Tri-Council. So that's the Canadian Institute of Health Research, NSERC. And, we compare that to the American NIH model, even the gutted NIH model that we are looking towards the South. It actually probably has more funding in the ecosystem per capita than our government. And that's just the unfortunate reality. Of course, there are foundation types of grants, and I think industry partnerships are increasingly important. We have to find a way to work with companies to be able to bring those technologies to the benefit of patients. But philanthropy is absolutely essential. And of course, we're so grateful at the Research Institute for the philanthropy that we've had up until now. And where I think philanthropy really plays a game-changing role is in those very initial beginnings. So our biomanufacturing facility that I told you I was so very proud of, that we got $90 million to invest at the Ottawa Hospital, that started through philanthropy. That started with a vision and an idea that no government agency was going to fund, because sometimes things are just too early. Another example is the Elevate program, which is grants usually for our more younger investigators, early startup programs, new collaborations. And I can tell you, as being a recipient of a foundation philanthropic grant very early on, it's not just the seed funding, which is usually a small amount to get enough data to kind of make the case for what you're doing, but it's also the knowledge that your community and your hospital believes in what you're doing. And so I think that philanthropy is absolutely game-changing in a lot of those initiatives and projects.
Nice. And just to echo, our researchers compete for grants. We're very successful. I think, again, punching well above our weight nationally for success for these granting agencies. But it is often those grants don't cover infrastructure support. The manufacturing facilities that Dr. Auer spoke about, they don't provide, limited overhead. So again, philanthropy is critical for that. So Cameron, I'm going to leave the last word to you. Jennifer said off the top, this is the largest healthcare infrastructure project of our lifetime. And maybe you could just, from your perspective, why you think community support is critical to this becoming the reality that we know it will be, but what's your message?
Yeah, so I'm going to steal a quote. Many of you know Roger Greenberg. I've had the great privilege of working with Roger for a number of years. And one of the quotes he said a number of years ago is, great communities are built on 4 pillars: sports and rec, arts and entertainment, education, and healthcare. And it's very easy in this day and age to get caught in the swirl of negativity of lots of challenges. And that's on us to figure out how we build capacity and reshape healthcare. But I'd suggest to you that this community probably has one of the greatest opportunities of any community across Canada right now, with the ability to build an organization like this, which will truly reshape healthcare, coupled with some of the things that are evolving with what we're doing with research, what we're doing with innovation, and what we're doing with building long-term care, adding primary care, adding surgical centers to try and build a better healthcare system. And so the message I'd leave with you is twofold. One is, while we do have our challenges, I also truly believe we have one of the most hopeful futures to build a better healthcare system, not just for us, but long after us, for generations to come. And the second thing is to thank you, because the reality is while Rebecca and I are up here and we have teams that lead all this is a community project. Healthcare is a community building block. And we can't do this without community support. And you've seen by the numbers, we have had tremendous support. And I think the support continues. And it's not just money, it's lots of other ways this community has supported us. And so just a very big thank you to you all in terms of helping us try and build a better healthcare system.
Wonderful. So on behalf of our audience, Dr. Auer and Cameron, really appreciate you taking the time now for this. I thought it was really informative discussion, and thank you for everything that you both do for our community. So we're going to head to dinner now and enjoy your table guests, and we'll be back shortly thereafter for the rest of our program. Thank you.